On behalf of Indian Pharmaceutical Association, Maharashtra State Branch Students Forum, welcome you all to this interview session. The Indian Pharmaceutical Association, Maharashtra State Branch Students Forum, one of the chief segments of the Indian Pharmaceutical Association, has been the go-to platform for pharmacy students in the state of Maharashtra for decades. Under the auspices of this student and organization, various budding pharmacists have united to harmonize their energies for exploring the boundless avenues of the pharmaceutical sphere. All the diverse facets of the pharmaceutical arena, be it academia, industry, community, hospital pharmacy, management, and public health, are emphasized by the conglomerate. We are grateful to have Dr. Mangal Nagarsenker as our guest for today.
Ma'am has completed her B.Pharm from Mumbai University with first rank securing IDMA gold medal. She has also completed M.Pharm and PhD in pharmaceutical science from Mumbai University. She has authorized 114 research articles and presented more than 100 research papers at national and international conferences. Ma'am has been granted 1 US patent, 2 Indian patents, and 3 trademarks. She has received Amrit Modi Research Fund, Distinguished Researcher National Award 2012, and Dr. Manjushri Pal Best Researcher Award 2013. She is the member of Pharmaceutical Dissolution Studies, Indian Pharmaceutical Association, Controlled Release Society, Indian Chapter and Association of Pharmaceutical Teachers of India, with a teaching and working experience of 35 years at BCP. Currently, she is affiliated as Professor Emeritus to Bombay College of Pharmacy and as an Honorable Professor and Research Advisor at Vivekanand Education Society's College of Pharmacy. Welcome, ma'am. It is a pleasure to have you here today.
Let's begin with the interview session. Moving on to our first question. Ma'am, we would like to know about your school days and how you were as a student.
Not for a long time, students have asked me about my school days. But I would be very happy to talk about it. My schooling is from Thane, from Dr. Bedekar Vidya Mandir, which is a Marathi medium school. And this school has a very rich background of cultural activities in addition to education. Our principal at that time was Shri Ashok Chitnis, who is a writer in his own right, was very avid, interested in literature, and it always invited many orators, poets, writers to speak to students. So it's like the school had lot of cultural activities going on, and my aptitude, of course, was more for science and maths. But because of school background, I had enjoyed all languages, including Sanskrit, and also drawing, handicraft, etc. But as a student, I have to say that I was very studious, like a teacher's student, and also shy, not really extrovert. So I did not so much participate in many cultural activities, especially the debates and orations, etc. But I remember one occasion when one of my teacher for a school formal program, suddenly she came to me and said that today you have to propose vote of thanks. So I was quite taken aback at that because I had not done that earlier. But she said, doesn't matter, you can do it. And I was actually wondering, I had not stood in front of mic any time before that for a formal function in front of whole school. But I did it somehow. And then I realized that possibly it is teachers' faith in you, student, and teachers' encouragement can take you through. So not that when I completed my school, I was very extrovert, but I could do few things which I was not doing earlier. But my teachers laid a very strong foundation for me, school teachers. And it's nice to remember them on today's occasion, which is Guru Purnima.
Thank you, ma'am. Thank you for sharing us about your school days. Ma'am, can you tell us about your family background and what led you to choose pharmacy as a career?
Okay, I come from a middle class family. So my father uh, was doing admin job. In fact, before my birth, but after he got married and he wanted to settle down, he moved to a stable and regular job like admin job. And my mother was primary teacher with two siblings. So it was a happy family with minimum needs, I would say. Uh, and but in both my parents have background of freedom fighters. In, my grandfather, my mother's father, was a teacher. Later on, he ran what is called as Chhatralay, which is for needy students. And at the same time, he was connected with freedom movement. So it's like their house was used by people as what you call um, when they are underground. So renowned people like, you might not know them, maybe by names, maybe you will know them, Sane Guruji, Barrister Nattai, Jai Prakash Narayan. These people have stayed in my grandfather's house on their hides or whenever they were underground during that moment. My father's brother was also elder brother, means my elder uncle was also editor of uh, a local paper called Samanata. And he used to write about freedom, India's freedom against British in that publication. So my uncles, maternal as well as paternal, they were jailed for during that freedom movement. So it was a very strong, spirited background formation. Besides that, I would say in my extended family, there are so many teachers. Uh, there are teachers for various subjects at various levels. My uncle, aunties, right from nursery teachers up to college level for different subjects. Of course, no one really for pharmacy. Must be the first teacher for pharmacy actually. But the background was like this. And if you ask me, how did I come to pharmacy? Well, in school, I was interested in science and maths. When I passed out from school, I took science, and thereafter, I didn't have this regular choice of being a doctor or an engineer. Engineer I couldn't go for because I had already chosen mathematics for my inter science, which is quite on par with your 12th standard. Okay. But at 12th standard, you people can take PCMB. For us, we had to choose either mathematics or biology. And why did I choose biology? There's no strong reason because I liked both. So it was very difficult to make a decision. But in thinking of something, I chose biology. My maths teachers were very upset with me because I chose biology and they were thinking I was good in maths and I should be doing maths. But I came to biology stream and then I was thinking that I will do physics, chemistry, biology, pure science, will go for graduation and post-graduation. But my father wanted me to do some professional course. So he started inquiring with people whether there are any professional courses which are open for PCB. And one of the acquaintance gave this information about pharmacy. It was not so well-known course at that time. But my father was convinced that this appears to be good course. So he actually facilitated the decision. And I was not so sure. So it was not pre-planned that I come for pharmacy. But I came by my own choice. It's not like There's nothing wrong in it, but it is not like I did not get admission for one course and that's why I went for another. Because when I passed out inter science, I had, you will find these marks very less, 69.5% was my score at inter science, which is analogous to your 12th standard. But that year, and usually 63% used to get admission in medicine. So I would have got admission in any college in Mumbai very easily. But that was not on my first preference, contrary to what regularly is done. And so I landed in pharmacy.
Wow, it's really fascinating to know about your journey and how it led you here today. Moving on to the next question. From being a B pharmacy student to a working professional, how do you describe your journey?
Okay. As I told you, it was not planned that I come to pharmacy, but I came. And once I was there were no regrets. I really liked it. I liked my studies in school. I liked my studies in what you call as junior college. And I loved my studies in pharmacy also. I did my graduation and post-graduation from UDCP, which is now ICT. At that time, it was known as University Department of Chemical Technology. So we had excellent teachers in UDCP. I remember classes taken by Professor Pradhan, Dr. Parmeshwaran for chemistry, Dr. Deshpande, Madam Baichwal for pharmaceutics, Dr. Vasudevan for pharmacognosy, and I liked all those subjects. Okay. So they actually left a deep impression on my studies and me, during my undergraduate curriculum. After that, I joined for masters, also not with a very strong planning, but I joined. Okay. And when I did masters, and I my masters were in pharmaceutics, okay. And Dr. Deshpande was my guide for masters. So after masters, then I joined Nicholas Laboratories. I had that feeling that I should work in industry after my masters, and I was fascinated by doing research in pharmaceutical company. And that was Australian company, and it was very good experience because they had all range of solid dosage forms, and it was not very big company and neither very small company. So it suited, and I started learning how to organize your work, how to prepare documents, etc. But unfortunately, company ran into trouble at that time, and then there was retrenchment, means they wanted to cut short on their staff. And we were all on probation in the first year. So the first action is taken on those who are on probation. So it's like those who are on probation were lost their job, okay, in addition to many others. So I lost my job, and that was not nice because that was the first job I took after my masters, and I lost it like this. So I felt quite bad at that time. But it is like one door closes, another opportunity is always there. And that way, what happened is BCP's principal for a very long time was Dr. H.P. Pitness. And he was my examiner when I was doing B.Pharm. So at that time, he found that I was very good in, actually he was my examiner for chemistry. He found I was very good in chemistry, and he had good impression about me. So he thought that I would be a promising candidate for teaching and also as PhD students. So that is how I landed in BCP, and I took my first job as lecturer. So in my first job, simultaneously I registered for PhD. So I was working for PhD also, and I was doing lecturer's job, which is mainly classroom teaching and instructing in lab, okay, supervising labs. And after a while, then I started teaching masters, started guiding master students, and thereafter PhD students. And then that whole process started of writing grants, proposals, then securing grants, doing industrial projects, and having international connections, etc. And overall, it has been very satisfying time.
It is really inspiring how you overcame all the hurdles. And okay, moving on to the next question. How did your parents influence your journey, and who was your role model?
Okay, whatever I have done so far, it was all possible because of support from my parents. Everything. During my school days, it's like everybody's parents support in your school days. I told you earlier that coming to pharmacy was kind of decision which was facilitated by my father, who was always for my education, or I should study as much as possible. Despite of being a girl, both my parents wanted me to study. I mean, I come from a family, middle class family, where education is given a lot of importance. So they wanted me to study. My mother also did not pass on any of the burdens to me. She did not feel that I should do a lot of work at home. Although I was doing something by my small initiatives, they did not pass on any burdens to us of middle class family or anything, any problems that they might have had. Not only during my studying time, even after I got married and when I was working, I was doing my PhD, I had great support from both my parents. And I think because of their support, I could quite focus on my work, though I was with 2 kids and a family to look after. It was so much easier because of their support. I think whatever I have done, I owe a lot of it. Everything was possible because of my parents. What was the next part of your question?
Ma'am, next part was who was
Oh, he was my role model. Okay, not one person really. I cannot cite one person as my role model. When I was in school, I had my teachers as a role model. So I think while studying time, it was my teachers, my guide for masters, who was Dr. Deshpande, and my guide for PhD was Dr. Tipnis, who was principal. He was like a guiding light for the college. He was a person with great vision for the college, and he was like guiding light for me also. So they were role models. Sometimes for some aspects, even friends, colleagues, and some researchers whom I have known through my through their published work, they were inspiration. So I cannot cite one person as my role model, but I am inspired by many, I should say.
Thank you, ma'am. Ma'am, our next question is, what is the subject that you specialized in and how did you incline towards it?
Okay. So if I have to say the specialized subject, then I would put it as drug delivery systems. But broadly, it is pharmaceutics. So, and you all know that pharmaceutics is a science of making dosage forms. But I feel, and I felt when I was studying also, that it is so well integrated with many sciences. Like it is integrated with chemistry part, it is integrated with physical sciences, it is integrated with biology. Inclination means pharmacology, where you look at in vivo part. And I was always fascinated by, you have to consider physicochemical properties of drug, excipient, when you are talking about pharmaceutics. You also need to look at machines, processes, like engineering, when you are looking at pharmaceutics. then you have so much of evaluation there of whatever is designed, those dosage forms. And you also look at what is in vivo performance. So what is happening in body. So there is also that biology part. So it's like a wholesome package, and I liked that very much. So as a student also, I have to say that I liked all subjects actually. So it was very difficult to decide that I like this subject more than the other subject. But if I look at both theory and practicals, the experiments that I did, I liked pharmaceutics much more. And possibly that is how I came to pharmaceutics. And it was not like everybody is taking pharmaceutics, so let me take pharmaceutics. I thought pharmaceutics is quite a combination of many things put together, and I like that very much.
Yes, ma'am, pharmaceutics is really a combination of lots of things.
Lots of things.
Even I'm interested in it.
And the way you spoke about it, it really shows your interest towards it.
Yes.
So the next question is, you have mentored more than 60 students today. What advice would you give students who wish to do a PhD and MPharm?
Piece of advice. Okay. First of all, I feel that a student should have aptitude for research. And when they have aptitude, then it's a very good line to follow master's, PhD. Of course, I agree that it is not very easy to know your own aptitude. Even I understood my aptitude only after I started teaching that I have aptitude for teaching. Though I had done some tuitions, giving tuitions earlier, but sometimes it takes time. But I still feel that whether you realize today or tomorrow, you should have aptitude for research. And within that, I feel students have to be curious about what they are doing, what is happening, and also should have good observation when they are doing experiments. For research, it is very essential that there should be curiosity, there should be thinking, and there should be good observation and lot of initiative to do things. Because it differs from regular practicals, like in the practicals, a teacher is instructing, you have to do all these things and the steps are given, what you have to do is exactly told, and you do that experiment. There is also skill in doing those experiments, observation and recording. But when you're doing research, with your curiosity, with your thinking, you start planning for the experiment. So curiosity is required, observations are required, and initiative, and there is no substitute for hard work. So it has to be there. And those who are doing research, I feel that there should be a lot of reading of the subject. Reading. Because if you are reading, you get to know what is happening in the world, what is happening in that subject, what are the gaps, means something which is not done, there is need of doing something, and how you can do it, you should be able to figure out. All this you can do only if you are reading a lot and you are aware of what is happening in that subject, in that stream, in the topic that you are interested in. And also, as a part of your research, you write papers, no? So that writing skill is also sharpened if you read a lot. If you read a lot of papers, you develop that skill of writing well. So I think reading is one part which is absolutely essential if you are going for research. And of course, above all, I think ethics is very important from student. Honesty is very important, because when you are doing research, not always you get positive results. You may not get good results. You have to be honest about it. And I have always been telling my students that negative results are so much important that if you document them well, you are actually saving time of the next person who might think about those experiments. Already knows he or she that yes, it doesn't give these expected results and I may have to do something more. So negative results are as important as positive results, and so you have to be honest of what you get and you should be able to explain what you get. And this is possible if you keep yourself updated by reading, by your thinking, of course, along with that, and how you can apply it. I think hard work is required, reading is required, curiosity is required. But so many people are doing it, so there's nothing impossible.
Yes, ma'am. I'm sure these pieces of advice will help many students in the coming future.
Moving on to our next question. You have received many accomplishments. So, which is that one accomplishment you are most proud of?
I think every achievement gives satisfaction, and that is because we work hard for it. So it is not very easy to pinpoint one. But if I have to say, then maybe I would say that completing PhD was one very satisfying achievement for me, coming from a middle class family. Then after getting married with a family and kids and with a job, you continue working and then complete your studies to your satisfaction. So that was one achievement I would say that gave me good satisfaction. But if I have to think over all these things, awards, then acquiring patents, trademarks, or getting good grants, all of them gave me satisfaction at those moments. But what stayed longer with me, then I have to say, if I was appreciated by teachers, or a compliment from colleagues, or more than that, sometimes when I felt that a student learned something with me or from me, that satisfaction lasted much longer than anything else.
Yes, ma'am, doing PhD is truly a big deal and it's a big achievement.
Moving on to the next question. What are your areas of interest, and can you tell us about various projects associated with research and the pharmaceutical industry?
You are asking about my projects, no? My projects and areas are quite connected, areas of my interest. So one of the area in which I am interested right from beginning, when I started research work as a guide, is solubilization and dissolution. So this is an area which with its application moves into pharmaceutics, but otherwise you can call it as a physical pharmacy, physical chemistry, and is very important. You all know that drug has to dissolve into something so that we get the effect that we want. So I have had planned and done also successfully projects which were for solubilizing drug, for enhancing solubility, sometimes for modulating solubility. So those were very interesting concepts, that you have a microenvironment around drug in such a way that it keeps dissolving even if the milieu is not favorable for dissolution. So that I would call as modulating its dissolution. or by way of complexation. And all these areas I found very interesting. Complexation with cyclodextrins, or modulating solid states of the drug. Means either you make from crystalline to amorphous for better solubilization, and then maintain it in amorphous state as a stable state of the drug. So this area all through has been one of my work area. Another area which I followed all the time was targeting. And a lot is talked about for targeting of drugs, mainly to cancer, but we were working even for targeting to skin, or targeting specifically to an organ like liver. And in between the two, you could feel that there is a connectivity by particulate systems. Means you have particles which may be microparticles or nanoparticles. Sometimes we made them for better solubilization, sometimes we made them for targeting, depending on what modulation we did. And the projects that I had, number of projects which were academic projects and number of projects which were industry projects. I cannot talk about many industry projects because of confidentiality requirements of those projects. But I can tell you a few, like one of the excipient company, we had 2 big projects. And the projects were on their excipient, how they can be, what is their role in the delivery system that we were making. So one excipient was for the purpose of sustaining drug release, and another excipient was for the purpose of enhancing drug dissolution. And both these projects were like, we had to prepare the dosage form on small scale in our lab, optimize it. That was one part. Then the second part would be, we have to take it to pilot scale. So we had to look for a facility elsewhere where they could be produced on pilot scale, and whether whatever formulation that we design, whether it is amenable for pilot scale up or not. And the third part was evaluating what we designed into human volunteers. So it had a big span, and particularly with the second project, which was for more solubilization of the drug, there were so many challenges in that design of the system that finally the company could get US patent. So the US patent that you read was for this project, in which excipient called Gelucire was used for enhancing bioavailability and solubilization of a drug, telmisartan. It was a very challenging project because they are very sticky materials at times, and to make tablets is not very easy. To produce them at high speed on large scale, pilot scale, is also not easy. And after doing all this, they should perform well in human volunteers. So it was learning for us also, and it was rewarding as well. So that was one group of project. I would say it went on over a long period of time. Was one industry project. Okay, we had 3 trademarks, and those trademarks, they were as part of our academic project, and they were all lipid-based delivery systems. Okay? And one of them is a vesicular system, which is like liposomes. Liposomes is a common term known to all graduates, at least, that there is one dosage form called delivery system called liposomes. So one is similar to liposomes. And then we designed one project that we will make this system specifically for targeting to skin, which means that if we have a product and we apply on skin, it should keep the drug in skin for a long time. And we develop then products for disorders like acne, psoriasis, or even to get a long anesthesia in skin for skin procedures. And one of the projects then of cutaneous targeting we secured funds from Indo-German collaboration. So there was a German university involved in this, and we were collaborating with them. So it was also exchange program when students from my lab went to Germany. They worked in lab there. There was exchange for professors also, and there was lot of experimental work. And here actually we got some facilities in their university which were not available here very easily to us. So it was very complementary type, and very good results, publications that we got through the project. We worked on another project, which I'm just telling you because I said that targeting was one of the area, has been one of the area of my interest. So in targeting, we designed some ligands. So this is chemistry actually, that it's actually a synthesis, a small synthesis of making ligands. And then those ligands were inserted in the liposomes. So these ligands then would take liposomes specifically to certain receptors. And in our project that we had planned, the ligands were planned for receptors which are on liver, acylo-glycoprotein receptors. So the drugs which are there in liposomes would then be delivered to liver cells. So we had anti-cancer agents and anti-infective agents, particularly anti-malarial agents for liver stage of malaria, to be prepared in these dosage forms. And when we were synthesizing so many ligands, we wanted to know which ligand would be really good, which will fit well. So this you have to do experimentally, then you have to do one by one and do a lot of experimentation. But it happened that I had gone for a conference and I met one professor, and that professor was doing similar work, not of synthesis, but fitting ligands into bilayers by molecular dynamics on computer. And he was ready to collaborate. So this professor from Finland collaborated with us. We collaborated with him, that we were preparing it, and he was evaluating with the help of simulations which ligands would be fitting very well. And then this was again work which was funded by Academy of Finland. So my students went to Finland. 3 of my students, turn by turn, went there to learn this work and also to find out what is good for us. Of course, after they found out, we still did experimentally and then we correlated it. But we got good ligands which could fit in those bilayers, and we could design those liposomes. We characterized them and we evaluated. And it was a nice project where we found that they really target the drugs to liver. They target anti-malarial agents also to liver parenchyma, which is a very, niche area, but very important area. We also have a project which is running right now, which is also extension of one of our trademark. And this project is for simplifying liposome manufacturing methods and is funded by Belgian government through a pharmaceutical industry. This is also a very good project in the area of my interest. So some of the projects that we worked, they were big projects. Like one of liposomal manufacturing process was part of CSIR 5-year plan funding project, and it was actually headed by IICT at Hyderabad, and we also had collaboration with CDRI Lucknow for that project. The project was on targeting on liposomes. So all this networking also gave a lot of opportunities to learn and to contribute simultaneously. So this may be some of my projects. Otherwise, I could go on and on talking about the projects.
That was very informative, ma'am. And it is really interesting to know how you were intrigued by the various arenas within pharmaceutics itself.
So moving on to our next question. Ma'am, you have presented more than 100 research papers at national and international conference and also completed many projects for the pharmaceutical industries. So what all challenges or hardship did you face during this journey?
I think challenges are always there, but if I have to list them, at least a few. The most important ones would be lack of facilities. Though, if I say Bombay College of Pharmacy is adequately equipped, or even I can say well equipped, if I have to look at only my work. But there are more facilities required when you want to add on dimensions to your work and to go deeper into any subject. We have an advantage that being in Mumbai, we can look at facilities which are in neighborhood. Maybe if we wanted to work on anti-cancer agents and we wanted to evaluate, say, anti-cancer activity, we could do it in ACTRIC, which is earlier Cancer Research Center. So you have it around Mumbai, but not all facilities and the funds which may be required for doing that. My lab and my group was actually well funded, I would say, because I had always restricted number of students also. So number of projects that were handled were not too many at a time. So funds were always adequate, but they are not on par with Western world. If I have to give you an example, if I want to look at the structure of liposomes, then maximum I can go up to with the facilities around is electron microscopy, which is transmission electron microscopy. But structures like liposomes don't remain stable many a times in these procedures. So it is better to have cryo transmission electron microscopy. And maybe you may have only at remote places this facility and working. So such facilities when you need, then there is difficulty. Also maybe sometimes you need a lot of time which you have to devote to the work. And as a research guide, sometimes I felt that I was doing undergraduate teaching, classroom teaching, and also research and some administration. So every function takes some of your time. But I have to say that I always enjoyed classroom teaching, which I found very satisfying, and I do that even today, and I find that equally satisfying as much as I find research rewarding and interesting. But each activity takes your time. So that is also one of the challenge, that you have to balance everything and devote as much time as it is required. But besides that, there weren't great difficulties, I would say. And challenges are finally your opportunities, means you have to find a way out and overcome it. And these were always balanced by, I would say, a very work conducive atmosphere at BCP, support from management, great colleagues that I had. And if I have to mention them, Dr. Mala Menon, Dr. Kutino, Dr. Kulkarni, who was teaching pharmacognosy there at that time, Dr. Jagtap, Aarti Jagtap, who was pharmacologist, and they were great colleagues. So they actually balanced whatever challenges were there. And above all, of course, the students. And that was one thing. There was never a case like good students are not available. So very good students, brilliant, hardworking, young, enthusiastic, they balanced most of those difficulties.
Thank you, ma'am. Despite of all the challenges and hardship, you kept focused and tried to overcome them.
Moving further, can you tell us about your current position? And when you look back at your life and all the difficulties that you faced, how did you overcome those difficulties and what did you learn from them?
Well, currently, you know that I work as emeritus professor with Bombay College of Pharmacy. So, as part of my work, I take few lectures because I still like to take few topics of my interest, and I also follow up the projects which are in process. Okay? Uh, and I'm very willingly I render my services if they require as an expert for any evaluation or in the committees where some opinion may be required. I am also affiliated to Vivekananda Education College of Pharmacy as research advisor. So there I follow up, I oversee their academic and industry projects. So it's what I should say is it's not round the clock work, but it is nice work. Okay, the work that I would like to do now at this stage. And the second part of your question was more about what were the challenges.
When you look back at your life and all the difficulties that you have faced, how did you overcome those difficulties and what did you learn from them?
I think partly I answered this question earlier, that there have been difficulties. There have been difficulties personally, like a woman who wants to do work, a focused work, and with kids, with family, they have to balance their family as well as work. But I think I had very supportive family. My parents were very supportive. My husband also very supportive, and my daughters were also very understanding. So from that point, I didn't have to really overcome. It automatically got settled. And I told you that there have been difficulties, like, sometimes, for example, if I have to tell you, you write applications for grants because you need funds for research. Not always in first attempt your applications are approved. At times, when you apply, after that your applications are evaluated, then you are called for defense and there is a task force. So often you are grilled by the task force, to find out whether your application really has that substance that they should fund you. So sometimes you don't succeed, but you get a feedback which is very good for you to improve. So I have always kept myself open to constructive criticism, I should say, if the criticism is constructive, because this has happened even when we are publishing papers. Sometimes back you were saying that you publish so many papers, but sometimes you submit the paper, it comes back with comments, that you have to answer those comments. And I look at it, and we should look at it as points to improve your work. So I feel there were challenges like difficulties, I told you, of funds, of facilities, of not getting sometimes things that you want specifically. But if you are patient, persistent, you still work on it, I think you reach there. And it's like, I will say that I don't always want a lift, elevator. I'm ready to climb staircase. I might take little more time. It's okay for me. When I'm taking time, I can look around and enjoy also. I'm not in great hurry. So I think that has helped me somehow to be in harmony at home, at workplace. And of course, it is also because of many other people who are around me I'm quite fortunate that I had good teachers, I had good students, and I had great colleagues.
I'm sure every student has a lot to learn from your determination and hard work, ma'am.
Thanks.
But not, last but not the least, ma'am, can you give a few words of advice for the students aspiring to be in the field of pharmacy?
I would first of all say that it is a great field. It's a very good profession, and because I feel that here is a profession where you can contribute to health of society. It may be by way of drug discovery or by way of making delivery systems, dosage forms, or by connecting to healthcare team and coming in direct contact with patient, counseling patient. But you have opportunity of a wide spectrum of contributing to health of society. And education wise also, I feel that pharmacy education is a good blend of technology and health sciences. So those who like technology part of it, processes, engineering part, it is also there. And if you like health science part of it, it's also there. So I would of course say that you need to be little patient, because if you have passed out from the college graduation and you may not immediately land up into a great job which is well paying, but if you are little patient, it is going to be more rewarding than many other professions, and very satisfying also, I feel, because you can contribute to health of society. You have to be ready to learn a lot, and whether you are in pharmacy or anywhere, there is no substitute to hard work. So I would say that students should be ready to work hard, but it is like in this pandemic also we have seen what is importance of drugs, and making drugs available at economic cost, and all that India could do as a pharmaceutical industry. I remember that in some of the speeches, our PM also, Prime Minister also has praised contribution of pharma industry. So I want students to remember that this is great opportunity. There may be challenges, but it's great opportunity.
Thank you, ma'am, for your inspiring words, and I'm sure that this will inspire all the students aspiring to be in the field of pharmacy.
I also want to thank you uh, for all these questions that you thought about, and also this opportunity of uh, this invitation to answer your questions of this interview, and also for this award, because students mean a lot to me, and therefore the award which comes from Student Forum also means a lot to me. I want to thank Student Forum and also your mentor, Dr. Anand Shedge, for this. Thank you.
With that, we come to the end of this interview session. I now call upon Master Aditya Dawale, the Joint General Secretary of IPA-MSB-SF, to propose the vote of thanks.
Thank you, Asta. On behalf of the entire IPA-MSB-SF team, I would like to thank Dr. Mangal Nagarsenker for their presence today and for sharing your journey with us. We feel exhilarated to have you with us, and thank you for allowing us to interview on such a short notice. We will be felicitating you during our formal function soon for your immense contribution to the field of pharmacy. I would thank our IPA-MSB-SF members, Ms. Pooja Gowde and Ms. Astra D'Souza, our wonderful hosts for the day. I would also like to thank Dr. Anand Shedge, Vice President of IPA-MSB-SF and mentor of IPA-MSB-SF, for his constant support and guidance. It's our greatest pleasure to have you with us today, ma'am. I'm sure your valuable advice will inspire everyone to strive for success and achieve their goals, overcoming all the obstacles. Thank you once again.
Thank you, students. Thank you all. And bye bye.
Thank you so much, ma'am.
Thank you so much, ma'am.